All right, so we've got this pretty hefty stack of materials you've given us.
Yeah.
And looks like a really thorough audio study guide for mental health nursing.
Yeah, it covers a lot of ground.
It does.
Yeah.
So we're going to try to distill it down to the real essence, the most important insights, right?
Exactly.
To give folks a working understanding without going into every single detail. You know what I mean?
Yeah.
A shortcut.
Yeah.
Yeah, like your personal shortcut to understanding mental health.
I like that.
All right, so your material highlights several areas that we should focus on. And it's kind of cool how interconnected a lot of this stuff is.
Absolutely.
Substance use and addiction.
Right.
Recognizing issues in the workplace, cognitive impairment, psychotic disorders, mood disorders, anxiety and trauma-related conditions, the nuances of personality disorders, care of the elderly, violence and abuse.
Yeah.
And then kind of this overarching theme of therapeutic communication.
Yes, very foundational.
So let's dive right in.
Okay.
Substance use. Your material really emphasizes understanding what different substances do to people.
Right.
And what their withdrawal symptoms look like. Like, for example, stimulant use is mentioned specifically.
Yeah.
What are some of the signs, physically and psychologically, you might see with stimulant use?
Well, it's important to remember with stimulants, you're talking about a huge range.
Oh, yeah.
You've got everything from caffeine to amphetamines.
Totally different.
So there's a real spectrum of effects you might observe.
What are some of the things you might see in your patients?
You'll see that classic increased alertness and energy.
Yeah.
But then in more severe cases, you can see things like paranoia, even hallucinations.
Wow.
Then when someone goes into withdrawal,
yeah,
you often see the opposite. You see that significant fatigue that sets in.
I see.
Suppressive symptoms, difficulty concentrating. It's like a rebound effect.
That makes sense.
And recognizing these shifts quickly is so crucial in a clinical setting, for intervention.
So it's like a crash after that high.
You could say that, yeah.
Okay, so the material also mentions chronic alcohol abuse and this medication disulfiram, which is also known as antabuse.
Right.
What is antabuse used for?
So antabuse is a medication that's used to support people in recovery from alcohol use disorder.
Okay.
And basically, it works by inhibiting the body's ability to process alcohol.
So if someone drinks while taking it?
Yeah. If they drink even a little bit, they get very unpleasant side effects.
Like what kind of side effects?
Nausea, vomiting, flushing. It's really designed to be a deterrent.
Oh, wow.
So patient education is key here. People need to know that even trace amounts of alcohol can trigger this reaction. And trace amounts can be found in surprising places, like some cough syrups or mouthwashes.
That's interesting. I never thought about that.
It's really important to be thorough in explaining these risks.
So antabuse only works if the person is really committed.
You could say that. It's not a magic bullet,
Yeah, it's a tool?
It's a tool, exactly. And it requires that the person is motivated to change.
Okay. And along those lines, your material brings up the concept of polysubstance abuse.
Yes.
Which speaks to just how complex addiction can be.
Absolutely. It's not uncommon for people to be using multiple substances at the same time. And it can make diagnosis and treatment much more challenging.
How so?
Well, sometimes people might be using multiple substances to try to enhance the effects of one drug.
Oh, I see.
Or sometimes they might be using another substance to try to counteract the negative side effects of another drug.
Wow. So it's a really tangled web.
It can be, yeah.
Yeah.
And then you have the CAGE questionnaire.
Oh, yeah. Tell me about that.
That's a really quick and easy way to screen for potential alcohol-related problems.
Okay. What does CAGE stand for?
CAGE.
Okay.
It's just 4 questions. Have you ever felt you should cut down on your drinking?
Okay.
Have you ever been annoyed by criticism of your drinking?
I see.
Have you ever felt guilty about your drinking? And have you ever had a drink first thing in the morning to steady your nerves or get rid of a hangover? The eye opener. It's a really useful tool.
For sure. Okay, so your material also touches on recognizing signs of opioid use, particularly intravenous injection, and just generally understanding what withdrawal looks like across different substances.
Right.
So let's talk about the opioid use first. What are some of the key signs you might see, especially with intravenous use?
Well, with intravenous opioid use, one of the biggest things to be aware of is the increased risk of infections.
Oh, yeah. Like what?
Like HIV and hepatitis C sharing needles is a major risk factor.
Right.
And being able to recognize the physical signs of intravenous use, those injection sites or track marks, is really important.
That makes sense. Okay, and what about withdrawal in general? What are some of the common things you might see across different substances?
Well, the specific symptoms can vary a bit depending on the substance. Yep. But generally, you're looking for things like excessive sweating muscle aches, anxiety, abdominal cramping. It can be a really rough experience.
For sure. So that covers substance use. Let's shift gears a little bit.
Okay.
Your material also talks about recognizing potential impairment in a colleague.
Right.
Which brings in this really practical aspect of mental health awareness in the workplace.
Absolutely. And it's about professional responsibility, but also maintaining appropriate boundaries.
Yeah, for sure. What are some of the behaviors that might make you think a colleague is struggling?
You're often looking for changes in their typical behavior patterns.
Like what?
It could be things like increased absenteeism or being late more often.
Yep.
Maybe their work quality is slipping, difficulty concentrating, uncharacteristic emotional outbursts, things like that.
So if you notice these things, what do you do?
The best course of action is usually to report your concerns to a supervisor.
Okay.
Or someone who is in a position to offer support and intervention. Remember, the goal is patient safety and the well-being of your colleague. So it's important to approach these situations without judgment or gossip.
Makes sense. Okay, let's move on to cognitive impairment. Your material points out how important it is to differentiate between delirium and other conditions.
Yes, absolutely.
So let's talk about delirium. What are the risk factors, the nursing interventions, and just the general characteristics of this condition?
So delirium is basically an acute, often fluctuating state of confusion.
Okay.
And what's really important to remember is that it's almost always triggered by an underlying medical condition.
Oh, I see.
It could be an infection, a medication side effect, dehydration, any number of things.
So what are some of the risk factors for developing delirium?
Older age is a big one.
Okay.
Having pre-existing cognitive impairment like dementia, and then having multiple medical conditions at the same time.
So it's kind of like your body is overloaded.
You could say that. And when it comes to nursing interventions for delirium, you're really focusing on two main things. First, identifying and treating that underlying medical cause.
Right.
And second, providing a safe and calming environment for the patient.
To minimize the confusion.
Exactly.
Okay. And then there's dementia, which is now called major neurocognitive disorder.
Right.
What are some of the key things you need to be thinking about with dementia?
Well, dementia is characterized by this gradual progressive decline in cognitive function.
Okay.
So because of that progressive nature, safety in the home environment becomes really important.
Like what kind of things specifically?
Things like removing tripping hazards, making sure medications are managed safely, providing memory aids and other environmental supports.
So it's a lot about adapting the environment to the person's needs.
Yeah, exactly.
And what about in the more advanced stages of dementia?
Well, in the later stages, the focus often shifts to providing comfort, managing distressing symptoms, like agitation or depression, and supporting both the patient and their family.
It sounds really challenging.
It can be. It's a difficult disease.
Your material also mentions some things that might make a nurse question an initial diagnosis of dementia?
Yeah, so if the cognitive symptoms appear very suddenly, that could be a red flag because dementia usually develops more gradually.
So that might point to something else.
Exactly. Like delirium, for example. Also the presence of unusual neurological signs or a very rapid decline in function.
I see.
Those things might suggest the need to look for other potential underlying conditions.
Okay, that makes sense.
Okay.
Let's move on to psychotic disorders.
Right.
Schizophrenia is a major focus in your materials. And one of the things it talks about is potential side effects of antipsychotic medications.
Yes.
Like acute dystonic reactions and medication-induced Parkinsonism.
Right.
Can you explain what those are and how you would respond as a nurse?
Okay, so acute dystonic reactions, they involve these sudden involuntary muscle contractions.
Where do these usually happen?
They often affect areas like the neck, the jaw, or the tongue, and they can be really scary for the patient.
A bit.
And then medication-induced Parkinsonism, as the name suggests, can mimic symptoms of Parkinson's disease.
Like what?
Tremors, rigidity, slowed movements.
Oh, wow. So as a nurse, what do you do if you see these side effects?
The key is to recognize them early on and to administer medications as they're prescribed to counteract the side effects.
Like what kind of medications?
Anticholinergics are often used.
Okay.
It's also really important to reassure the patient.
Right.
Because these reactions can be very distressing.
For sure. Do we know what causes these reactions?
It's thought that it's related to how the antipsychotic medications work.
Okay.
They block dopamine receptors, and that can lead to an imbalance with other neurotransmitters like acetylcholine.
Interesting. Okay, so your material also mentions second-generation antipsychotics.
Yeah.
And some considerations for patients who might also have metabolic syndrome.
Right.
It seems like physical and mental health are so interconnected.
They absolutely are. So second-generation antipsychotics, they're often preferred because they tend to be better at treating the negative symptoms of schizophrenia.
Okay.
But they do carry a higher risk of causing metabolic syndrome, which includes things like weight gain, high blood sugar, high cholesterol.
So monitoring is key.
Absolutely. People on these medications need regular monitoring of their weight, their blood glucose levels, and their lipid profiles.
To catch any problems early on.
Exactly.
Okay, so the material also talks about understanding the negative symptoms of schizophrenia and assessing for risk of violence.
Right.
It also specifically mentions nursing interventions for auditory hallucinations.
Yes.
So let's unpack all of that, starting with negative symptoms. What are those exactly?
So negative symptoms refer to a decrease or absence of normal behaviors and feelings.
Okay.
Things like flat affect, which is reduced emotional expression, social withdrawal, lack of motivation.
It's like they're withdrawn from life.
Yeah, it's like a dimming of their usual personality.
That's sad. And how do you assess for risk of violence?
Well, you're looking at a few different factors.
Okay.
Past history of violent behavior. Impulsivity, substance use.
And are there certain types of hallucinations that are more concerning?
Yes, command hallucinations.
Where the voices are telling them to do something.
Exactly. Telling them to harm themselves or others.
That's really scary. Okay, and what about nursing interventions for auditory hallucinations in general?
The goal is often to help the person distinguish between the hallucinations and reality, teaching them coping strategies like distraction techniques, and of course supporting them in taking their medications as prescribed.
Right. Okay. Your material also emphasizes understanding the different phases of schizophrenia?
Yes.
The premorbid, prodromal, active, and residual phases?
Right.
And what kind of data might be concerning for a nurse?
So the premorbid phase is basically before any obvious symptoms appear.
Okay.
There might be subtle signs, but they're often nonspecific. Then you have the prodromal phase, where you start to see more noticeable changes.
In what?
Their behavior, their thinking, their perception.
But not full-blown psychosis yet.
Right, it's like a transition period.
Okay.
Then the active phase is when you have those characteristic psychotic symptoms.
Hallucinations, delusions.
Exactly.
And then residual.
The residual phase is after an active episode.
Okay.
And the psychotic symptoms have lessened, but there might still be negative symptoms and difficulty functioning.
So it's like a roller coaster.
In a way, yeah.
Yeah.
And as a nurse, you'd be particularly concerned if you saw a sudden worsening of symptoms.
Okay.
Or signs that they weren't taking their medication. Or an increase in risky behaviors like substance use.
That makes sense. Okay.
Yeah.
Let's move on to mood disorders.
All right.
Your material talks about bipolar disorder and specifically nursing management of a patient in acute mania.
Yes.
What are some of the key things you need to keep in mind in that situation?
With acute mania, you really need to be calm, consistent, and structured in your approach.
Oh.
Therapeutic communication is crucial.
Like what kind of things?
Using simple, direct language, setting clear, firm limits on behavior, avoiding getting drawn into arguments or power struggles.
Right. It's about staying in control.
Exactly. You also want to provide a safe and structured environment and carefully monitor for things like exhaustion, dehydration, and poor nutrition.
Because they might not be taking care of themselves.
Exactly. They might be so caught up in the mania that they neglect their basic needs.
Wow. Okay. And your material mentions lithium therapy for bipolar disorder, and it emphasizes understanding the signs of lithium toxicity.
Yes, lithium toxicity is a serious concern.
So what are the signs and what lab values do you need to monitor?
So lithium has a narrow therapeutic range.
What does that mean?
It means the difference between a helpful dose and a toxic dose is quite small. So you have to be really careful. So signs of toxicity can include nausea, vomiting, diarrhea, tremors, confusion.
Okay.
And the key lab value to monitor is the serum lithium level.
In their blood.
Right. You need to check those levels regularly to make sure the dose is safe and effective.
Okay, so monitoring is really important with lithium.
It's essential.
Your material also mentions relapse prevention in bipolar disorder and the importance of self-soothing skills.
Right. So relapse prevention really comes down to a few key things.
Okay.
Consistent medication adherence, early recognition of warning signs.
Like what kinds of warning signs?
Changes in sleep patterns, mood shifts, things like that.
Okay.
And then using effective stress management techniques.
Right.
Self-soothing skills are also really helpful.
Like what?
Deep breathing, mindfulness exercises, engaging in enjoyable activities, things that help regulate their mood.
It's all about finding healthy ways to cope.
Exactly.
Okay, let's talk about depressive disorders. Your material notes common symptoms and the use of SSRIs in treatment. It also emphasizes the importance of assessing for suicidal ideation.
Yes, that is absolutely paramount.
And it mentions monitoring for mood and behavior changes after starting antidepressants.
Right, because sometimes those changes can be unexpected.
In what way?
Well, sometimes people experience a temporary increase in suicidal thoughts when they first start taking an antidepressant.
Really?
It's a bit paradoxical.
It is. Why does that happen?
It's not fully understood, but it's thought to be related to changes in brain chemistry.
Oh, wow. So close. Monitoring is critical.
It's so important, especially in those early weeks of treatment.
Your material also talks about other therapies for depression?
Yes.
Like CBT and ECT.
Right. So cognitive behavioral therapy helps people identify and change negative thought patterns and behaviors.
And ECT?
Electroconvulsive therapy is a more intensive option for severe cases.
Okay, and your material also mentions the SAM-HSA recovery model for both substance use and mental health recovery.
It's a really important framework.
What are the key principles?
It emphasizes hope, empowerment, self-determination, and the belief that people can recover and live full lives.
Even with these challenges?
Exactly. It's about shifting the focus from illness to recovery.
I like that. Okay, let's move on to anxiety and trauma-related disorders.
All right.
Your material talks about caring for people with anxiety disorders, especially in acute panic states. What are the best interventions in that moment?
In a panic attack, the priority is providing reassurance, creating a calm environment, and helping them slow their breathing.
So just staying calm yourself.
Yeah, your calmness can help them calm down.
That makes sense. And the material mentions anti-anxiety medications.
Yes. Benzodiazepines are commonly used.
But they have side effects.
They can cause drowsiness, and there's a risk of dependence.
So they're not a long-term solution.
Not usually.
What about non-pharmacological approaches for anxiety?
Things like establishing a regular sleep schedule, a relaxing bedtime routine, good sleep hygiene.
Those are all good for everyone, really.
They are.
Okay, and your material talks about generalized anxiety disorder and the symptoms you might see with moderate anxiety.
Right, so GAD is different from panic attacks because it's more of a chronic, persistent worry.
It's not just an episode.
Exactly. And with moderate anxiety, you might see things like increased heart rate, sweating, muscle tension, racing thoughts, difficulty concentrating.
So it affects both the body and the mind.
It does.
And in the realm of trauma, your material talks about PTSD.
Yes.
What are some realistic goals for people with PTSD?
Well, it's about helping them manage their symptoms, process traumatic memories, develop coping skills.
So they can function better in their daily lives.
Exactly.
And what about in a crisis situation?
Safety is the absolute priority.
Of course.
Preventing self-harm or harm to others, providing a safe environment, connecting them with resources.
It sounds like a lot to manage.
It can be, but having a plan is crucial.
Okay, your material also mentions different personality disorders.
Yes.
Like borderline personality disorder, antisocial, avoidant, dependent, and histrionic.
Right.
Can you give me a brief rundown of each of those?
Okay, so borderline personality disorder is characterized by instability in emotions, relationships, self-image, and impulsivity.
Okay.
Antisocial personality disorder is marked by a disregard for the rights of others.
Okay.
Avoidant personality disorder is extreme social anxiety and fear of rejection.
So they isolate themselves. And dependent personality disorder.
They have an excessive need to be taken care of.
Okay.
And histrionic personality disorder involves excessive emotionality and attention-seeking.
So it's a wide range of presentations.
It is. And it's important to remember that these are enduring patterns.
Right.
They're not just temporary states.
And your material talks about maintaining a therapeutic relationship with people with borderline personality disorder.
Yes, that can be very challenging.
What are some of the key principles there?
Consistency, empathy, and firm boundaries are essential.
And what about when they exhibit challenging behaviors?
You have to set clear limits, ensure safety, and avoid getting drawn into their emotional intensity.
So stay calm and professional.
Exactly.
And what's the main goal of treatment for personality disorders in general?
It's often about helping them develop better coping mechanisms, improve their relationships, and reduce the distress they experience.
Okay, so let's turn to care of the elderly.
All right.
What are some of the unique considerations there?
Well, establishing rapport with elderly patients often requires patience and understanding.
Okay.
You need to be mindful of age-related sensory changes like hearing loss or vision problems.
Right.
And it's really important to be able to differentiate between delirium and dementia.
We talked about that before.
Yes, it's crucial for making sure they get the right treatment.
Okay, now let's talk about violence and abuse.
This is a heavy topic.
It is. Your material talks about the nurse's role in domestic violence situations.
Right.
What are the key things to remember there?
Safety planning with the victim is paramount.
What does that involve?
Helping them identify safe places, escape routes, having a bag packed with essentials.
Okay.
And you need to be aware of cultural influences that might affect their situation.
Right. Some cultures might make it harder to leave.
Exact.
Your material also mentions indicators of child neglect.
Yeah, things like poor hygiene, signs of malnourishment, lack of medical care.
And what about interventions for survivors of sexual assault?
The priority is their safety and well-being.
Of course.
Providing emotional support, documenting findings, preserving evidence if they want to pursue legal action.
And your material mentions rape trauma syndrome.
Yeah, that describes the common pattern of symptoms that survivors might experience.
Like what?
Initial disorganization and shock, followed by a longer phase of reorganization.
It sounds incredibly traumatic.
It is. It's a very difficult experience.
Finally, your material talks about the overarching importance of therapeutic communication in all patient interactions.
It's really the foundation of everything we do.
So what does it involve?
It's about using both verbal and nonverbal communication techniques to build rapport, gather information, provide support, and just create a safe and trusting environment.
So people feel comfortable opening up.
Exactly.
So as we've seen, the landscape of mental health is vast.
It is.
And your material covers a huge amount of information.
From the biological effects of substances to the complexities of relationships and trauma.
It's really fascinating stuff.
It is, and it's all interconnected.
That's what's so cool about it.
Like the SAMHSA recovery model.
Yeah.
It applies to substance use, but it also applies to chronic mental illness.
And differentiating delirium from dementia.
Right. That's a crucial assessment skill.
So I think this deep dive gives a really solid foundation in these key concepts.
I hope so.
It really makes you think about all the different facets of mental health.
It does.
So I'm curious, what area sparked the most curiosity for you?
That's a good question.
And what further exploration might be helpful for you?
Because that's where the real learning begins.
Exactly.